excited about this one, but a lot of you have been hearing me talk about Chapter lately in the videos because they're awesome, number one. But we also have Ari Parker, the co-founder of Chapter, joining us today, an absolute expert on Medicare. So we're going to be jumping in and answering a bunch of your questions that we've seen popping up in the chat box on live streams and down below in the comment section recently on videos. So hey, Ari, thanks so much for joining us. We really do appreciate this. Thank you so much for being here with us today.
Thank you so much for having me, Matt. It's an honor to be on your channel.
Thank you. We really do appreciate it. So if you don't mind, we'd love to get into these questions. We've got a bunch of questions that people have sent us here on the channel, and we'd really like to jump into those if that's okay with you. You think so?
Let's do it.
Okay. So first off, number one, I know that you talk a lot about this three-legged stool as it pertains to Medicare. Do you want to explain that just really quickly so everybody kind of on the same page here as far as what you mean by that?
Yes. You can picture Medicare as a three-legged stool, and I write about this in my short book, Explaining Medicare. The title is It's Not That Complicated. So picture Medicare as a three-legged stool. You need all three parts in order to achieve comprehensive coverage. The first leg of the stool is inpatient coverage. What happens when you're at the hospital? It means you have a wristband. The second leg of the stool is your outpatient coverage. How do you cover things that happen outside the hospital, like visits to the doctor, visits to specialists, lab work, MRIs, x-rays, even durable medical equipment goes to the second leg of the stool. And then finally, the third leg of the stool is your drug coverage. What are you going to do for prescriptions? Now, each of these legs correspond to parts. So Medicare Part A is your inpatient hospital coverage. Medicare Part B is your outpatient coverage. That is what happens outside the hospital. And then the third and final leg of the stool is Medicare Part D. D is in drugs.
Thank you.
Yeah, that's a super easy way to look at it. And that's the thing that I really like about your book too, is again, it's not that complicated, the title of your book, which is Medicare. When you initially look at it, it's like, oh my gosh, this is so complicated. There's so much about it. And it can be very, very confusing. But just thinking it from the analogy that you just gave us, that really, really simplifies it right there, right? I mean, that's really great. Yeah, thank you so much for that. Do you have a couple of questions you want to read?
I can read a couple questions here that we created, and then we'll get into anybody who has any questions, please write those in the comments. That would be awesome.
Yeah, for sure. If you're joining us live, feel free to stick your questions in, and we can work through those together on those. Yep.
Okay. So I'll start with the first question that we have. If someone is turning 65 this year, when should they connect with a chapter advisor for their Medicare needs? Or maybe we should even just have you just briefly describe what chapter is in case if somebody's just jumping on right now. Is that okay?
Yeah.
Absolutely. Chapter is your one-stop Medicare resource. We're here to answer any questions you have about how and when to apply, and then to make sure that you have comprehensive Medicare coverage and select the single best fitting plan for your needs.
That's great.
That's perfect. Yeah. Thank you.
So when should somebody who's turning 65 contact Chapter?
So someone who's turning 65 should contact Chapter 3 to 6 months before the month in which they turn 65. So let's say Matt's birthday is December 23rd. So Matt's turning 65 on December 23rd. Mm-hmm. Matt should contact us in the summer. And as long as he applies for Medicare in September, October, or November, then Matt's Medicare will begin December 1st. It's always dated to the first of the month. Mm-hmm. Now, if Matt waits until December in order to apply for Medicare, then his Medicare will be delayed by a month, at least a month. And we don't want that, because what is Matt going to do for health insurance then? Now, I do want to mention an exception here. Matt, you're already on Medicare, right?
Yep.
But you're a lot younger than 65.
Yep.
So Matt obtained Medicare by way of disability. If you've been receiving cash disability benefits for at least 24 months, then you automatically receive your red, white, and blue card, even if you're younger than 65.
Mm-hmm. Exactly. Yep. That's a very good analogy. Yeah. And that's another thing too, as well, that, I get questions about sometimes is, hey, can I get SSDI and then get my Medicare right away? It's after that 24-month period of time. So yeah, there is a little bit of a wait versus with retirement benefits. You get that Medicare pretty quickly then too, in that situation. If somebody was on Social Security or again, just applying for Medicare. So yeah, very good analogy. Thank you for that one.
May I mention one more thing?
For sure. Yeah.
There might be some viewers here who are past age 65, but they're still on theirs or their spouse's work provided insurance. That's totally fine as long as your employer or your spouse's employer has 20 or more employees. That's the critical number, 20 employees or more. So if yours or your spouse's employer has 20 employees or more, then you can remain on that work provided coverage. However, when you or your spouse are ready to retire, then you ought to apply for Medicare so that way you have continuous health insurance coverage. And that's a really important nuance here for your viewers who are above age 65 and wondering what their timeline for applying to enroll in Medicare is.
Super important. Yeah, thank you for pointing that out. That's very important. It's kind of easy to overlook that too sometimes. That's very important. Thank you. Yeah.
Okay. So let's see here. PC 2053 wants to know, what about Medicaid?
Great question. So again, if you have Medicare and Medicaid, then you aren't allowed to be billed by a provider. Your benefits, your health insurance is administered by the combination of Medicare and Medicaid. With that said, you might want to consider a dual special needs plan that coordinates benefits between Medicare and Medicaid, because there are some things that the combination of Medicare and Medicaid don't cover that a dual special needs plan might. For example, additional benefits like dental, vision, hearing, even some come with a grocery benefit, for example.
Yeah. I know for a lot of people in the community here, I've been seeing a lot of comments on live streams about that grocery benefit. That's a huge benefit for a lot of people that love those plans like that have the grocery benefit. I mean, that's massive right now with food prices the way they are. That's a really nice one.
And this is a really important point because there are over 24,000 plans nationwide. There are over 24,000 different Medicare plans to choose from. So though Medicare Part A and Part B come directly from the federal government, Medicare Part A and Part B don't cover all of your medical and hospital costs. It still leaves you on the hook for 20%. So one way to cover that 20% would be if you qualify for Medicaid, that is, if you're low income. Another way to get that 20% covered would be by choosing one of two different types of plans. And so that's the good news. Though there are 24,000 plans nationwide, and they vary zip code by zip code, depending on where you live, we can broadly sort those 24,000 plans into one of two types, either Medigap, which is also known as Medicare Supplement, or a Medicare Advantage Plan, which is a replacement for original Medicare administered by a private insurance company. And this demonstrates the importance of working with an independent, unbiased advisor who has access at the touch of their fingertips to all of those thousands of plans that exist nationwide.
Definitely.
That's incredible.
Yeah.
Go ahead. No. I have a quick follow-up to that. So I've talked about this, about the advisors over at Chapter doing amazing work for so many people here in the community. Again, hundreds of people here in the community have already called them and connected. Absolutely amazing. But I do have a quick question about that. Okay, so you talk about the 24,000+ plans across the country, which honestly is nuts. I mean, why are there so many plans, right? That just seems really, really odd that there's so many. But okay, so there's 24,000 plans, and they have access to looking at the majority of those at their fingertips. But when they look through these, how do they have algorithms, or like what do they use to look through all of them and find the perfect set of plans in a local area for the people that call in? Like, what's the kind of the process behind that?
Well, it's actually a really good thing that there's 24,000 different plans that exist nationwide, because that allows for choice. But the way in which someone sorts through them is the critical point that you mentioned, Matt. Here at Chapter, our advisors use a proven recipe in order to sort through those 24,000 plans using our database that catalogs each and every one of these plans. And in a one-on-one consultation, our advisors will want to know about your viewers' providers, that is, who are the doctors that they see. They'll want to know about your viewers' prescriptions, what medications do they take, because this has a large impact on price, whether it's a brand name or generic, and what pharmacy they like to go to. And then the final P that we'll discuss is your viewers' priorities. What's important to them? Do they have a second home in a different state? Do they plan to travel abroad? Do they have an RV?
So it truly is like very, very personalized. I mean, that's very personalized right there. I mean, so they're really going through with a fine-tooth comb and really finding everything that person needs and really isolating the plan for them.
Precisely.
Nice. That's perfect. Yep.
So I have a couple people who are asking questions, and I think that the answer's kind of like, well, you'll see. So somebody, let's see here. Legend Nebula, thank you so much for asking this
Hey,
question.
Legend. Nice to see you.
They have a question. Have you ever heard of Blue Care Plus of Tennessee, which I feel like it's not very good and it's not for my category. Is there anything better? So what would you say?
Unfortunately, we can't discuss any specific
Yeah.
insurance companies.
Yeah.
We want to
Of
keep this
course.
general.
Yeah.
However, please connect with us so that way we can go through your 3Ps, your providers, your prescriptions, your priorities, and find the single best fitting plan for you based on your needs.
Yes, I mean, it sounds
100%.
like Legend Nebula, like that would be like chapters like made for you because
Yeah, right.
you're not happy with what you got. So
Yeah.
let's see what is best fits you based on these 3Ps, which we just discussed. So I mean, that's awesome.
Perfect.
I hope
Yeah.
that this really can help you because it should.
Perfect. Hey, Legend, so nice to see you. Thanks for being here as well. But yeah, I've been mentioning this in the live streams as well lately, which is that's the kind of the situation is so many of us feel like, hey, we've got this plan. Don't love my plan. It doesn't really cover anything for me, right? I know a lot of us, way too many of us are in that situation. But again, this is exactly what Chapter does. I mean, they are literally professionals on this. Like you heard Ari talk about, and we just mentioned here, you know, the 24,000+ plans, they have access. They know what they're doing here, and they're like wizards when it comes down to this, right? So, I mean, seriously, 100% free. Oh, we'll get to that here in a second as well. But yeah, it's 100% for free. When you call them, connect with them, I mean, they literally do all this work. They look through everything, and they can really help you out find that better plan that better suits you rather than the plan that you have now that looks like you're not all that happy with. So yeah, Legend, you may want to give them a call. Seriously, probably be worth it just to have that conversation. So
yeah.
I mean, I
one more
feel
thing.
Well, like knowledge is
thing
power. Like the more information you have, like the more comfortable you'll be. Like when you actually like get that plan, and the less confusing it is to have somebody who can actually like really help you. It's just, I feel like just it would take such like a anxiety load off to like have somebody who's so knowledgeable help you.
Yeah, that's absolutely the goal, to create a stress-free experience where instead we can have a conversation about finding the right plan based on one's needs. And let me just mention one more thing. We can sort those 24,000 different plans nationwide into 2 categories. Remember, one type is Medigap, which is also known as Medicare Supplement. And the second type, which this user, it sounds like the type of plan that they're on, is Medicare Advantage. Right now is the Medicare Advantage open enrollment period, which ends March 31st. And so this is your opportunity to review your Medicare Advantage coverage for 2025.
That's great to know.
That's really good to know. You know, I think that this is one of these situations where it's kind of like, well, wasn't open enrollment, you know, end of last year? No, I've had so many people asking me about this over the last, few weeks here, which is, hey, that closed last year. No, it's the open enrollment right now, which is again, January 1st through March 31st, as Ari just stated. At the end of the year last year was the annual enrollment period. So yeah, 2 different periods here, but this is again focused, a lot of people out there for Medicare Advantage, things like that. So yeah.
And this period pertains to that second type of plan that I mentioned, Medicare Advantage plans. So if there's something that you're dissatisfied with your current Medicare Advantage coverage, then this is an additional opportunity in which you can review your coverage and make a change before March 31st.
Perfect. Real quickly on that, let's just say that somebody, wants to change their plan, time slips away from them, it turns over to April 2nd, and they look at the calendar and think, uh-oh, didn't change my plan. Do they have any options?
So if the calendar turns to April, then we would be looking to see if they have a special enrollment period. And one might be able to qualify for a special enrollment period if, for example, they're moving or that they've been affected by a natural disaster.
Okay.
That's great to
know. Or
if
they've had a change in their Medicaid or Part D extra help status.
Okay. One quick follow-up on that. Is there a minimum number of miles that someone would need to move to be qualified to be, in that special enrollment period? Do you know? Because you said one of the options would possibly be moving. Could they move 2 doors down and be like, hey, I moved. Can I get a special enrollment period?
I'm not aware of a mileage restriction on the nature of the move.
Sure.
With that said, if their plan isn't offered in the area in which they're moving to, then they might receive a guaranteed issue right to switch from a Medicare Advantage plan to a Medigap plan. So that is, they can go from option 2 to option 1 by way of guaranteed issue if their Medicare Advantage plan isn't offered in the area where they're moving to.
Perfect. Thank you for that. Awesome. Or do they have
Yeah,
any
I'm gonna
questions?
another question. Norma message. So thank you, Norma.
Thanks, Norma.
She said, I have part A, B, and D and extra help, but I'm still getting billed. Again, I know we can't answer specific questions, but I mean, I would go ahead and say call chapter, right? I mean, if you have questions about your plan, right? Can you, or like.
We can definitely answer this one. So here's how Norma's situation applies. So anyone who qualifies for Medicaid also qualifies for Part D extra help. So to Norma's question, it sounds like she earns too much in order to qualify for Medicaid, but she still qualifies for Part D extra help, which is great. Part D extra help covers Norma's prescription costs, and it lowers her copays by a whole lot of money. However, we still need to look at Norma's hospital and medical bills because she earns too much, it sounds like, in order to qualify for Medicaid relief. So instead, we should see what plan might fit within her budget to cover her healthcare costs affordably beyond her drug costs.
Okay.
Okay. Now, really quickly, if I can, I know we hear about all these different plans out there. Can you confirm, are there zero premium plans that are available? I know that's kind of, dependent on regions and stuff like that, but I've had people ask me that, like, hey, is there really such a thing as a zero premium plan, a $0 premium plan?
Yeah, it's a great question because, again, people are seeing all types of advertisements about $0 premium plans. Let's unpack what that means.
Okay.
So remember the three-legged stool. There's Medicare Part A, that's your inpatient coverage. There's Medicare Part B, that's everything outside the hospital. And then there's Medicare Part D, your drug benefit. There is a monthly charge for Medicare Part B. It's $185 per month unless you qualify for Medicaid. So what's not in the fine print when Medicare Advantage companies advertise that $0 premium is that you still owe your Part B premium of $185 per month to Uncle Sam. So though your Medicare Advantage premium might be $0, you still owe the Part B premium of $185 per month unless you qualify for Medicaid. And actually, Matt, to your point, 65% of Medicare Advantage plans approximately have a $0 premium.
Okay.
That's really good to know.
But they're still on the hook for the Part B premium.
Unless they qualify for Medicaid.
Right. Okay. It's really good to know. Yep. Yeah. Very good. Okay. Thank you for that.
Thank you. Thank you so much, Norm. I hope that helps. So next, Harris Friedman wants to know, thank you so much, Harris, for your question. We
Thanks,
really
Harris.
appreciate it.
Nice to have you.
Am I going to lose my dual Medicare plan? And then also, I don't understand why we're talking about Medicaid when we are about to lose it. So can you speak to that, Matt?
Yeah, Ari, do you want to take part of that? And I can take the other part about the Medicaid possibly, losing that. I can jump on that.
Yeah, Matt, I know you had a video yesterday about the bill that just passed the House.
Yep.
So let me address the first part of Harris's question about the possibility of losing Medicaid. So it sounds like, Harris, you've already qualified for Medicare and Medicaid, and you've selected a dual special needs plan in order to cover the coordination between your Medicare and Medicaid coverage, which is great. So if there's no change to your Medicaid status, then you are welcome to remain on that plan. If you lose your Medicaid, however, then you will receive a special enrollment period to select a different plan. And that's exactly what we would be here to help you with. And we can also help you if you're unsatisfied with any portion of your dual special needs plan.
Perfect. Yeah, very well said. If you'd like, I can jump on that really quickly about the Medicaid thing. Yeah, so I know it's super concerning. I see a lot of questions about this. I mean, seriously, the last couple of weeks have been nuts. I think we can all probably agree with that. I've been talking about it in the live streams and videos. But yeah, okay, so here's the thing. Medicaid's not going away, okay? Medicaid is certainly not going away. I know there's a lot of talk about it being reduced and things like that. They may reduce it to some degree, okay, but they're certainly not going to with the program. In total, every year, Medicaid costs about $900 billion. It's a massive program covering about 72 million people. Certainly not going away. They may reduce it by about 10% of output per year as in expenditures. That's kind of the talk right now, okay? What I would say about that, let's just see how this whole thing settles out. Let's see how the dust settles on this. But right now, it seems a little bit concerning, but I really don't think lawmakers are going to let this fly. I'm just saying that, okay? Let's just give it a little bit more time here, how it goes. Medicaid's certainly not going anywhere. They may reduce expenditures by like 10-ish% over the next 10 years. It sounds like a lot of money, but it's also a massive, huge program. So I can certainly keep an eye on that and keep you posted, which I will. But yeah, we can certainly talk about that in a lot more detail in a separate video. Yep.
Yeah, thank you.
Yeah.
And thank you so much, Harris, for that question.
Yeah, thank you.
Okay, I'm going to just go through another question here. I'm going to paraphrase a little bit. Lorenzo Williams, thank you so much for your question, Lorenzo. Yeah. He receives Medicare and Medicaid, and he's 65. And he wants to know, he has a question about a plan that would cover something that he's looking to get done. Can you tell us what you would recommend in terms of like?
Yes, so Lorenzo's question is about coverage for a nose job.
Yes.
Unfortunately, if that's an elective procedure, then it likely wouldn't be covered by Medicare. So it depends on the necessity. As long as it's medically necessary, then original Medicare would cover it.
Okay.
Very interesting.
Thank you.
Okay.
That's
Thank you for
really
that.
helpful.
Mm-hmm. Do you have more questions?
Why don't you ask a question, and then
Okay.
I will look through here.
So, Ari, we've been talking a lot about Medigap plans, Medicare Advantage, things like this. How does somebody know what would be best for them? Like, how do they know? Should I take traditional Medicare? Should I take Medicare Advantage? Like, how do they make that determination? What would be best for somebody? Like, how do they even go down that road and figure out which side of the road do I go on here? Do you kind of have some like general guidelines to use on that?
Yeah. I love this question. Thank you for bringing it up, Matt.
Yeah.
So broadly, there's two types of ways to achieve comprehensive coverage. Option one is to choose a Medigap plan, which is also known as Medicare Supplement. This sits on top of original Medicare, so it preserves the flexibility of Medicare, which is networkless. So that means you don't need anyone's permission in order to get a second opinion. You can also receive coverage in a different state. So if you're visiting your grandchildren in Florida, but you live in Minnesota, it's no problem getting care when you're in Florida. So that's what people really like about option one. However, with option one, with choice comes a higher premium than what they will have under a Medicare Advantage plan commonly. So if you are able to afford the premium for option one, then it can be excellent flexible coverage. The only thing I should mention here is if you choose Medigap, then you would want to add a standalone prescription drug plan. So that way you have your Part D covered. If you don't, then you might face a lifetime late enrollment penalty. So even if you don't take any prescriptions at all, it's still important to get Medicare Part D. The second type of coverage that you can choose, and you can't have both, it's one or the other. It's either option one or option two. Option two is Medicare Advantage. This is a replacement for original Medicare administered by a private insurance company. Now, if all of your doctors are covered and you don't have that many healthcare needs, then option two might be a really good fit for you. Medicare Advantage might work really well based on your circumstances. What people like about Medicare Advantage is that it's typically lower premium than option one. 65% of the plans have a $0 premium, but you still owe that $185 per month for Medicare Part B to the government. So you still owe your Part B premium to Uncle Sam unless you qualify for Medicaid. What people also like about Medicare Advantage is that it's all-in-one coverage. So it administers your original Medicare through a private insurance company, and it comes with a maximum out-of-pocket protector, which original Medicare doesn't have. So let's use the example of my mom. My mom lives in the Chicagoland area. Last summer, she needed a knee replacement, which is a $50,000 procedure.
Wow.
Had my mom just had original Medicare, she would have owed $10,000 for her knee. And then she broke her elbow the following month, and she would have owed 20% for everything related to the elbow as well.
Wow.
So regardless of whether you choose option one or option two, it's important to have some type of coverage for the maximum out of pocket, because under original Medicare, there's no ceiling on that 20%. Under option one, that is a Medigap plan, your maximum out of pocket under the most comprehensive type, which is plan letter G for someone who recently turned 65, would be $257 for the upcoming year. So your maximum out of pocket, if you choose Medigap plan letter G, would be $257 for this year. Under a Medicare Advantage plan, they would still have maximum out-of-pocket protection, which beats just having straight original Medicare, which doesn't have that type of out-of-pocket protection.
Mhm. Okay.
Thank you. I
Wow,
feel like this
that's-
is, you know,
yeah.
I'm just going to say, hearing you talk about this, it is so helpful. Just like having this conversation with somebody who understands Medicare and plans. I mean, Kyle, everybody needs to watch this video.
Yeah.
This is such great information.
Yeah.
I'm so thankful for this experience.
This is exactly
like my mom needs to watch this.
Yeah, my dad.
Corey, we'd love to help your mom.
This is
Yeah,
great. Thank you
sure.
so much.
Yeah, this is wow. I mean, I really appreciate you sharing that story with your mom. I mean, that really makes it, very much real. That's a real good example that you shared with us. So, wow. Yeah. Yep.
That's really super helpful. Next, I have a question from Intermission. Thank you, Intermission, for your question.
Yeah, thank you.
I have Medicare but have disability. How old do you need to be to qualify?
If you have Medicare by way of disability, then it sounds like you already qualified. The criteria is that you are receiving cash disability benefits for at least 24 months. And those can be non-consecutive. So it could be 2 12-month periods that would still qualify you for Medicare by way of disability.
Perfect.
Okay. Hopefully that helps Intermission. Thank you.
Yeah, really good question. Hey, really quick follow-up to that. So one question that I've seen in the live streams quite a bit is a lot of people in my community receive SSDI and SSI. Well, okay, one or the other, I should say. Very popular benefits, very similar benefits, but also very different at the same time. One question that I have been seeing is people say, hey, I'm on SSDI, I'm qualified for Medicare. Can I also be enrolled in Medicare Advantage? Can I take advantage of that? So can you answer that question?
Well, if you have Medicare by way of disability, then you have Medicare Part A and Part B. And what we would want to do is make sure that you also have drug coverage and then choose the right Medigap or Medicare Advantage plan based on your 3 Ps, based on your providers, your prescriptions, and your priorities.
Okay.
So the answer is yes.
Great.
Absolutely. Okay. One other follow-up to that as well is I know you just mentioned right there that it'd be best to get a Part D plan, a drug plan. Is somebody required to get a D plan?
You're technically not required in order to get a Part D prescription drug plan, but there's a lifetime late enrollment penalty if you forego coverage and you don't have something that's considered at least as good as what Medicare Part D would have covered. So even if you don't take any prescriptions at all, it's still worth getting a Medicare Part D plan in our experience. So that way you avoid the lifetime late enrollment penalty for Medicare Part D.
Got it. Okay. So if someone forgoes the Part D for, say, 10 years, they could be racking up a huge penalty when they do eventually take it.
Correct. They would be racking up 10 years of lifetime late enrollment penalty. So when they sign up 10 years late, unfortunately, they're going to be assessed a lifetime ongoing penalty for all the months in which they did not have Part D coverage.
Got it. Just a quick little side note here. When I got SSDI benefits for blindness, I passed up on the Part B coverage for a couple of years. Didn't know what I was doing. It was many years ago. Passed up on that. And eventually I was like, I should probably get Part B. So I enrolled in it. Yeah, I got the lifetime penalty on Part B. So still paying for that today. Yeah, exactly. So I know exactly what you're talking about there. That's
that's a really important point. There's actually 2 lifetime late enrollment penalties. There's one for Medicare Part B, which you just mentioned, and then there's one for Medicare Part D. So there's 2 separate lifetime late enrollment penalties. And this is why it's so important to join a live stream like this and to just get educated on what the timeline is for enrolling in Medicare.
Exactly. And that's the thing. I didn't know at the time. I had no clue.
Yeah, you were like 21.
In my mid-20s. Yeah, mid-20s.
Wow.
No idea what I was doing. I thought, I don't need it. I'm healthy. I'm 24 or whatever, 25. I've passed up on it for years and I'm still paying for that today. So that penalty it's rough. I mean, seriously, it adds up fast. So yeah. And again, a simple free live stream like this could have saved me a lot of money that I'm literally still paying for now. So yeah, pretty cool. Thank you for that answer. Appreciate it.
Yeah. Okay. I really like this next question. I think Doc Enick, thank you so
Doc.
much. You're always here.
Doc
this
is
great.
awesome. Yeah, thanks, Doc.
So I really like your question. So someone has Medicare and Medicaid. Does it really matter what plan they have? Like, if they have A, B, C, and D, does Humana versus Aetna versus Priority Health, does it make a difference?
Yes, it can really matter because these private insurance companies set different terms and conditions on your coverage. And we want to make sure that the plan that you choose has all of your doctors in network, because we don't want you to miss out on a doctor's appointment just because your insurer doesn't cover that particular provider. So we need to make sure that the plan covers all of your doctors. Then we also need to make sure that it covers all of your prescriptions and that it meets your priorities for this year.
Perfect.
That's great. I really appreciate that.
Yeah. Ari, would you recommend that people shop plans every year? You know, like car insurance or something like that. Would you recommend like every year, every 2 years that they should shop plans during open enrollment or annual enrollment just to see like, hey, is there a better option out there? Things change literally every year. Things change. Our needs change. Our medical needs change. Premiums change. All this stuff like that. So do you think that's probably good practice?
Spot on. You should review
Okay.
your coverage every year during the
Yep.
annual enrollment period, which is October 15th to December 7th.
Okay.
And it's as simple as getting on a call with somebody from Chapter, right? I mean, so it's not like super scary to like shop a plan. All you're doing is calling Chapter and they can help you.
Mm-hmm.
I mean, is that correct?
Yeah, people can, of course, go to medicare.gov,
Yeah.
or they're welcome to
course.
call our team for support.
Yeah. So, I mean,
Yeah.
it doesn't have to be some like super stressful thing. They're like, oh gosh, I got to figure this out. It's like somebody can help you and maybe you're on the right plan and that'd be great too. So
Mm-hmm.
it's just nice. It's nice
Yeah.
to have a resource. I feel like my parents are going through this right now. Matt's parents just went through it.
Mm-hmm.
It is like so incredibly stressful for people. But if you have such a trusted like company you can call who, I don't know, doesn't make you feel pressured, doesn't make you feel like confused and answers your
Mhm.
questions. I mean, I just feel like being on the call with you right now makes me think, oh, when can we sign up? This is something
Right.
I would understand. Insurance is
I'm going to start blushing here in a
This is
minute.
great.
Right. Yeah, like Corey said, her parents are literally going through it now. My parents just went through it. I helped them. I share this story in my videos sometimes that I help my parents with this. We tried to hack it out ourselves to trying to find a supplement for them. We got a supplement, but the problem is it's the wrong supplement. I was literally just talking to my parents this morning. Literally this
Mhm,
morning, we saw
yeah.
my parents. We're talking to them about it. And we're like, yeah, sorry about that. Hacked it out ourselves. Not a good idea. We didn't know what we were doing at the time. Again, this was last year, getting them that supplement. I don't know their medical needs. I mean, they're my parents, love them, everything like that, but I don't know what they need medically and what kind of coverages
Mhm.
they need. And again, if they would have had an advisor asking them the questions that I didn't know to ask at the time, like the advisors over at Chapter do, they could have asked all those questions and found them the right plan rather than just a plan. Like unfortunately we got for them. So they're locked in a little bit longer. So I always like to say to my parents, sorry about that. But hopefully they'll forgive me about it, which I think they do.
Yeah,
So,
and to put an exclamation on that story you just shared, Matt,
Mhm.
it's so important to work with an independent, unbiased advisor who has access to all the plans in your zip code, not
Yeah.
just one insurance company's plans or not just a subset of insurance companies' plans, but all the plans, and then can sort those plans based on your 3 Ps, your providers, your prescriptions, and your priorities.
Perfect. Yeah, I really like that approach.
Yeah. I just think of
Perfect.
like all the hours that my parents have spent like talking to, I mean, just to me about Medicare. And I'm not even there. You know what I
Mhm.
mean? And like Matt. And it's like, oh, when it's
Mhm.
time, when you're in your 3 to 6 months or whatnot, I
Yeah.
mean, call Chapter and you'll
Yeah.
just like it'll be a load off your shoulders, you know? It'll
Mhm.
be narrowed down, your needs will be met. It's just such a relief, I would think,
Mhm.
to have a place to call that you can trust and not feel stressed about.
Exactly. Her parents are kind of getting into the stage that my my parents went through last year. Every time you see them, they've got their list of questions. Hey, you got an hour to answer a bunch of questions? I'm like, I guess let's do it. Right. So,
Yeah, it's just a
yeah.
lot.
But I get it. It can be very confusing. And
Mhm.
again, it's why the guys over at Chapter, again, amazing team over there helping everybody out. Yeah, they're doing all this 100% for free. And again, I've been saying in my videos lately too, like how many people do all this stuff for free anymore? Like, I mean, seriously, who works for free like this? Not many people, right? So yeah, it's incredible to see what they're doing over there. It's absolutely amazing. I've seen so many really good success stories about that. By the way, comments coming in. I was just on a live stream last night. Jerry came in. Jerry's telling me his whole story. Loved the communication he had with Chapter. Really awesome there. I mean, that was awesome. You saw the comment.
I
from
did.
Jerry.
I was like
Yeah.
super excited.
Yeah, really encouraging to see this. Yeah.
Harris wants to know, is Medicaid still going to cover the Medicare savings program even though they voted to cut Medicaid?
Yes, I have not seen any changes proposed to the Medicare Savings Program. The Medicare Savings Program is the way that someone would qualify for Medicaid, depending on the level of Medicaid that they qualify for. So great question, Harris.
Okay, thank
Thank
you.
you. Yeah, thank you. Do you have more questions
I
from them?
don't.
Okay. Do you have questions on our list from them?
Let me see here.
We'll see what else. What other questions we have here from everybody that's submitted them over the last couple of days here. Again, we kind of been compiling them,
Mhm.
but
I'm just trying to make sure that we haven't covered these already. Okay, so one thing really quick is when if I'm in that space where it's time for me to call, what information should I have ready to talk to my chapter advisor about? So can you walk us through that a little bit?
Yeah. So prepare a list of your 3 Ps. Prepare a list of the doctors, your providers, or the institutions that you'd want to go to. And this can change, of course, year over year, which underscores the importance of reviewing your plan every year. The second thing to have ready is a list of your prescriptions. Whether it's a brand name or generic, the dosage matters too. And of course, the frequency with which you take those medications and what pharmacy you like to go to. And then finally, have a wish list of things that you wish your Medicare covered. We want to talk to you about what you love about your health insurance or what can be improved upon about it.
That's great.
That's really nice. Yeah, I feel like a lot of people would never think of that. Like, what do I want out of a plan? Yeah, that's typically probably not a question that many people get, right? But I think it's a very good consideration, again, when shopping plans. Excellent. Yeah, that's
and
really
also,
good.
it sounds like, I mean, that's an easy list to compile. It's not going to take too long to write those things down, have those things available. So it's not like a hard thing to prepare for that call. So that's kind of a good feeling too. Let's see here. I think we may, I don't know if I'm going to ask this question. I'm not sure if we've covered it, and maybe we have. Why would someone choose Medicare Advantage over traditional Medicare? I kind of think you answered this, but I'm just going to throw it out there.
It depends. Medicare Advantage certainly has its place. It depends on how much you've saved for retirement. If you've saved enough for retirement and you want the most flexible, comprehensive coverage, then original Medicare, a Medigap plan, and a standalone prescription drug plan might be right for you. If, on the other hand, you're reliant on Social Security income, then Medicare Advantage could be the way to achieve comprehensive coverage and get all of your doctors covered, all of your drugs covered, and also find those additional benefits that might be important to you. So it really depends based on your circumstances, whether option 1 or option 2 is right.
Definitely.
Okay. Yeah, that's the thing about it is there's so many different plans out there. Everybody's personal preferences are very, very different, which I've talked about in videos, which is, I've had some people reach out and say, well, what do you recommend? It's like, it's so hard to say. I don't know. I'd have to hear like half your life story to know, right?
And you wouldn't Matt wouldn't
know.
have a clue because he isn't a Medicare advisor.
Exactly. So
that's why we need to have people like Chapter out there, like companies like this, to help.
Exactly. Yeah.
Oh, I love Shirley's question about TRICARE for Life. May I mention TRICARE for Life?
Oh, yeah. It just came up. Perfect.
So first of all, Shirley, thank you for your service to our country. So TRICARE for Life is a benefit that's offered through the Department of Defense. And essentially, it's a free Medicare Supplement Plan for retired service members and their spouses. So that means you should not change anything about your coverage. Take that free Medicare Supplement Plan from the Department of Defense and just make sure that you sign up for Medicare Part A and Part B.
Perfect.
Great. Thank you. Thanks, Shirley Kirby.
Yeah. Thank you, Shirley. That's awesome. Thank you. Nice to see you, by the way, Shirley. Thanks for being here. Okay. We have other questions?
I think those are the only questions that I'm seeing come in right now.
Okay.
I think we've answered the questions. Do you have anything else that you'd like to add, Ari, before we let you go?
I would just add that we're delighted to be a resource for your viewers who have any questions about Medicare, their loved ones coverage, or even an acquaintance's coverage. So feel free to ask us anything Medicare related. That's what we're here to address.
Perfect. Love it. Thank you. Yeah, your team has been helping so many of us here in the community. It's awesome. Seriously, I can't tell you how many positive comments I've seen coming in. Just a lot of very satisfied people. It's really nice to see, honestly. It's just really, really good. I'm just so happy with it. Yeah, thank you very much to you and your team over there. It's really, really nice. Yeah, thank you. Okay.
So we will end it here, and we just appreciate your time. Thank you so much.
Thanks, Ari. Really appreciate it.
Okay.
Thanks so much for having me. It's been a blast.
Yeah, absolutely. Thank you.
Thanks. Bye-bye.
I know.